Hi, I am Sami Ghazwan from Bahrain. I'd like to take you through an episode to explain to new riders how do you buy a new horse. What do you look at? How do you know if this horse has got any injuries, old injuries, new injuries, how you check him and how you go all about that. We'll get into that into details. If you're interested in buying a horse, you want to make sure first of all that this horse is suitable for you. His level of riding, and then what sport does he do? If you're buying a jumping horse, you want to make sure that the horse jumps to the limits that you can jump, not below. Two, you want to make sure also to check the horse very well. I know some places around the world it's very difficult to find a vet to check the horse for you, but I'm going to show you a few tips to look at to make sure that you can check the horse. One of the most important things is that you look at the overall of the horse body, and you will see if there are any lumps or any swellings around the joints or around the back. If you don't see anything that looks abnormal, then the horse may look okay for you, but you want to check first of all at the age of the horse. I'm going to explain to you how to look at that, but then the eyes are very important, the sight is important. So how can you do? You just take your hand and just move him in front, and if the horse starts to move his lashes up and down, that the horse he can see, because usually if a horse has got a problem with the eye, if you do this, he's not going to move his lashes. Two, you want to look at the joints. The most important part are the front joints because they have the most pressure. So you want to check the fitlock, and you want to check the tendons, and of course the knees, the hooks. And I'm going to show you some videos now between a horse with injuries and a horse that is very sound. I'm going to show you now an example of a horse who's got a swollen fitlock. It's a very old chronic swollen that this horse has got an injury. It doesn't hurt him now. However, he will not be suitable to become a sports horse. I would not recommend you to buy a horse with any swollen fitlock such as this injury. This is an example of a horse who looks okay but has got an old tendon injury. So this horse was treated because he was an ex-racing horse. It looks good, but I think after very hard work, this can get back, which means he will give you a problem in the future. So I would not recommend the horse which has got a chronic tendon injury at all. This is a very good example of a horse with very good legs. He's got clear tendons with very good fitlock joint. So if you touch it here, you're going to rub your fingers and you're going to feel the tendons very clearly with no swelling whatsoever. So I could say this is a perfect fitlock with tendons and knee joints. When you go to buy a horse, you will always ask the owner of the horse if the horse has got any injury. Usually, the owners will not be extremely honest and tell you that this horse has an old injury. So sometimes the owner will keep the horse in the box for about 10 days or more with some medication, and when you ride him first, you will not be able to tell if the horse has got an injury until you buy him and you use him for several weeks or months until you find the injury. I'm going to show you now some steps to try to test your horse, if you don't have a vet of course, to see if the horse has got an old injury or not. And we're going to focus on the joints from the shoulder joint, so from the shoulder down to the knee, to the fitlock, to the hoof, back to the back fitlock, the hook and the stifle joint. These joints, if you do a flexation for them, you might be able to tell if the horse has got any injury, and it will be very clear for you whether you can buy the horse or not. Usually horses, when you go to check them, you will see a swelling in the hind fitlock or in the hind leg. This swelling usually comes from horses who are not used. When they stay in their box for a long time, lots of liquid comes and stays here. It is not a very big deal. Many horses can work with this swelling, and with some work it will disappear. The body will suck it up. So I don't say that if you see a horse with a little bit of a swelling, he's a very bad horse. Sometimes you will not like to buy a horse with a swelling because it does not look good, but this usually is okay to work with. When you buy horses, make sure that you check the horse in their box so they don't do wind sucking. Can you see this horse? He's a windsucker. He puts his chin on the pipe and he pulls it out so he gets some air inside. in general, we don't buy horses who have this habit because they will teach the other horses to do this. At the same time, their teeth and their jaw might change in shape so they don't look good. So the price will go very down. However, this thing does not have anything to do with the performance of the horse or the general health of the horse. Apart from having more wind in the stomach, he should be able to work and do the performance well, but the movement of the thing he does is not recommended to keep it with other horses close by. Okay, now we will be explaining how to check the horse's back. The horse's back muscles and the spinal vertebra is very important to be checked. It's always useful to do an X-ray if it's available, but places where you cannot do an X-ray, it's important to see the flexibility of the muscles and also to see if the muscles are responding. To respond, you need to take a pin and you need to come over and to touch the horse. If you see these touches, the horse is responding, it means the muscles are well maintained and he doesn't have any stiffness. So to check any stiffness in the back where the saddle is usually kept, we would always use a pin and we will pinch the horse and see. If he doesn't respond, he may have a problem. All the horses who have good muscles, back muscles, they usually respond to these pinches. So this is how you check the horse's back. Important to check your horse's joints, which we call a flexion test. The flexion test is important to show if the horse has got any injuries, either in his fetlock, in the knee, or in the shoulders. How we do this, we pick up the horse's leg, we put the knee against our thigh, I push with my thigh this way to put more pressure, and then I pull the hoof this way so I can put the pressure on all the joints. So where joints are there will be a pressure, and I count from 30 to 40 seconds. Immediately after I finish the 40 seconds, I let go of the horse and I tell the guy to trot. To trot, straight line, and then slow, and come back. I would always remind you, if you can get a vet to take x-rays over the joints, is way much better. It will tell you all the things inside. But if you don't have a vet and you don't have the facility of checking with the vet for an x-ray, you will pick up the back leg and you will do the same. You will try to bend the hoof up and pull all the joints to try to put some pressure on them and count from 30 to 45 seconds, keeping the leg up there. And then once you finish the 45 seconds, you let go and you ask the guy to trot. Now when he trots, he will show a lameness immediately if he has any lameness. If he doesn't have any lameness, he will look very normal. Dear viewer, it's very important. We did the flex now on the hard ground. It's so important for you to also check the horse in a lunge. You have to put the horse in a trot, in a lunge, and this will tell you if the horse has got any problems with any of his joints, and it will show a lameness. So you have to trot him on both sides, right and left. It's very important also that you trot the horse on a softer ground and also on a harder ground, because some horses will not show the lameness on the softer ground, sandy ground, but it will show on the harder ground. So you try on both sides, probably 5 minutes on both sides. That will tell you if the horse has got a lameness or not. This is a good example of a horse. When you put him on the lunge, he looks like he's lame on the hind left inside. This will only show because he's on a lunge. If he's on a straight line, you probably will not see it. So it's very obvious now when you trot him that he trots and he shows a bit of pain on the inside hind leg. I truly hope that you've enjoyed this video and you learned from it whenever you're going to buy a horse. I have lots of videos on YouTube. Follow me, and I look forward to seeing you soon with my next video about horse riding in general.